Everybody's heard about hair loss, and actually didn't even put hair loss on this one. It's because a great many of chemotherapies don't actually cause hair loss. And nearly every medicine that they prescribe for breast cancer does cause hair loss. Most of the chemotherapy for lung cancer and pancreatic cancer are also going to cause hair loss, but there's a great many chemotherapy regimens for colon cancer, for prostate cancer, for example, and of course the capecitabine Xeloda, which is the oral chemotherapy, does not cause hair loss. Some of them cause hair thinning, but the typical cancer patient has no hair, right? This is something we're trying to combat and help people understand that it's not just about the hair loss, and there's a lot more going on under the surface when it comes to what chemotherapy is doing to your body. So chemotherapy in the blood, one of the most common side effects of chemotherapy in your blood is neutropenia. And neutropenia is a severe lowering of your white blood cell count. It can also affect platelets, red blood cells, can affect iron levels. This is primarily what's making people susceptible to infection. This is what's making people tired, lethargic, because basically your defenses are being stripped from you by the chemotherapy drugs. There's a treatment that most cancer patients on difficult chemotherapy receive exactly 24 hours after that treatment, and it's called Neulasta. Neulasta or Neupogen is a different version of it. But you may have seen commercials on TV talking about Neulasta Onpro, where there's like a little sticker on, and a day later it automatically deploys and shoots you with a drug that helps stimulate your white blood cell count. That would terrify me. I don't know. I don't think I could handle waiting to that shot hit me in the arm. But these drugs are phenomenal in preventing infection-related issues because of the white blood cell count. And that's the primary reason for treatment delay is, you can't continue to tear your body down again and again and again, because it literally will kill you if you don't take the time to recover. The issue with drugs like Neulasta and Neupogen is that they cause tremendous body pain. Most of your white blood cells are made in your sternum, in your breastbone, and also your long bones in your leg. So basically it causes a much greater activity in your long bones and your sternum, which can literally cause your bones to vibrate. The pain is sublime. But it reduces the risk of infection down to about 3%, which is phenomenal, and it allows the patient to receive treatment on schedule, which really is the best chance of receiving a better response to the overall treatment process. It's pretty infrequently known that chemo brain is something that is a side effect of chemotherapy. So chemotherapy causes cognitive impairment that lasts sometimes weeks, months, sometimes it's permanent in certain patients. And it does so by causing damage to some of the cells of the brain. Most patients on chemotherapy report short-term memory issues, difficulty doing tasks that they did easily before. I remember distinctly not being able to do my job. I mean, I knew what I was doing, I just couldn't find the right process to go about doing it. So I remember just staring at my computer screen and crying because I never expected it to be that bad. So we certainly ask, as cancer patients, the world to be patient with us as we rebuild those faculties and become a little less absent-minded, because it's a real medical condition in the brain. Mouth sores, also something people don't really know much about. It's a common side effect in a lot of the push drugs, like I showed you guys earlier, and it's also going to be a big side effect from the anti-tumor antibiotics that we talked about earlier as well. And these mouth sores aren't limited to the mouth. They actually can go all the way down the throat and down deep in the esophagus. So a lot of patients report having difficulty swallowing, difficulty keeping food down, because it really does hurt to eat. There's a number of different mouthwashes that patients use, and even some mouthwashes that are swallowed to help with that. And many of us will actually hold ice water in our mouths while getting the push, because you can actually feel chemotherapy coming up in your throat and causing damage to those healthy esophagus cells and mouth cells. So prevention is a really key factor in the mouth sore world. So it can't prevent everything. So we manage it with things called magic mouthwash and Biotene and stuff like that. And of course, maintaining good oral health is really important when you're working with mouth sore. Something that nobody likes to talk about are the digestive issues that are caused by chemotherapy. So everything from diarrhea to constipation, and you can experience that in a very short amount of time where it's going from one extreme to the other. Chemotherapy can be very dehydrating. So as you're going through treatment, make sure that you stay well hydrated and drinking lots of water to flush out all those toxins, to remove them from your body once they've been administered. Chemotherapy is toxic to your heart. So there's some drugs, for example, like the adriamycin, the Red Devil, that you actually have a lifetime cap where at a certain point that drug will actually make your heart stop beating. So I've reached my lifetime cap of adriamycin. I won't ever get to take it again, which I'm more than happy to oblige. There are other drugs that are more cardiotoxic than the adriamycin, but it's certainly up there. It can cause damage to the valves and cause damage to the blood vessels leading to the heart. So this is another reason we need better treatment options for cancer, because this is unacceptable to have to choose between having a heart attack and treating your cancer. Certainly not something I would ever want to have to choose again. Muscles and motor skills. In addition to chemotherapy's effect on your muscle movement, just the overall lack of activity that most people experience when they're going through cancer treatment. Typically, muscles will atrophy. You'll experience muscle breakdown. It's important to stay active during chemotherapy. I know that seems a little counterintuitive, and people are like, well, I'm exhausted, I can't stay active. I promise you, it is something very well worth the investment. If you're able to stay active, take a short walk, take a quick bike ride, it will certainly pay dividends down the road. And it'll also help with some of the chemo-related weight gain. Yes, I said gain. Most people assume that I'm on chemo, I'm going to lose a bunch of weight and look really, really fragile. In most cases, with all the steroids being administered to protect your body before you actually get the chemotherapy, most patients actually report weight gain, especially for cancers of the breast and the ovaries and the uterus. In many cases, it can be 20, 30, 40 pounds or even more. So another body image issue to deal with, obviously, and another factor to consider for your health. So stay active. It'll certainly help with side effects and also with some of that unintended weight gain as you go through the treatment process. Nausea and vomiting is another one of those constant Hollywood reminders of chemotherapy. They have tremendous drugs now, antiemetics, that allow you not to throw up, not even once. The nausea is there, but there's some really fantastic drugs on the market today. Aloxi, Zofran's an older drug, but Aloxi is a drug that they typically administer before you get chemotherapy. So they call it a pre-med, and it will literally prevent every bout of vomiting in most cancer patients. So they've come a long way. When I first started cancer treatment in 2009 for my early stage breast cancer, I remember I would get one of those pills, be $100 a piece. And it was just a sample that my oncologist had. So it was certainly something I was glad to have, and it was just hitting the market at the time. And then the last major side effect of chemotherapy that I have listed is loss of appetite. Many patients report taste changes, things tasting really metallic or oily, just an overall difference in what their palate is used to. We recommend, of course, not eating your favorite foods on days of treatment, because it can actually cause you to dislike them a great deal, especially if you were to get sick on one of your favorite foods. So they typically recommend bland foods, bland diet. Try to stay away from anything spicy because of those mouth sores, and make sure you're getting enough nutrition. The protein intake is really important during chemotherapy because it's going to help build those muscles back up and also help your body repair a little faster as you go from treatment to treatment.